This broadcast is brought to you by Colby Brooks with Century 21 Right Pace Real Estate and buyfrombrooks.com. Let Colby Brooks handle all of your real estate needs. Over 300 cases now reported across the state of Arkansas, but we're also talking about some other numbers that have not gotten as much attention about how many completed tests are actually being performed in NEA. It's not very many. It's now in Randolph County, too, the latest numbers from the Arkansas Department of Health confirming that. We'll talk about that, plus Dr. Shan Speights joins us for a phone call to tell us more about this stuff and what happens if we reach hospital capacity. We've got a lot to talk about on NEA Report right now.
Stan Morris reporting.
COVID-19 continues to move across northeast Arkansas, with Randolph County now being the latest county added to the list today, along with Lonoke County outside of NEA. Thanks for joining us. It's Stan Morris reporting with you live today on NEA Report here in the 3 o'clock hour, where the latest numbers for Arkansas: 335 confirmed cases of COVID-19. That is, along with 1,504 negative test results. In other words, we're pointing out that there's only been about 1,839 tests processed so far. I said about, I think that may be the exact number, but I did that off the top of my head. Unfortunately, there's also been 3 deaths. We've learned this afternoon in the press conference with the governor and the Secretary of Health, Dr. Nate Smith. 3 Arkansans have died. According to the reports, they were all from central Arkansas, although I think one was Cleburne County, which is somewhat closer to northeast Arkansas. They've had an outbreak in severe proportions. The governor making a major announcement just a short time ago, announcing that additional payments were going out to support nurses, and not a moment too soon as well. He announced that $1,000 a month or $250 a week will be sent to nurses on the front lines of this. We're talking about non-physician nurses, by the way. Also, if there's a COVID-19 patient present, i.e. if they're treating in a facility where COVID-19 has been confirmed, that pay will increase to $2,000 a month or $500 a week. A major announcement, almost one of the first of its kind, perhaps. I'm not sure if we've heard of something like this. I'm not, but that's not to say it hasn't happened. However, a very aggressive initiative to keep nurses on the front lines and to keep them hopefully recruited too. Some other initiatives announced as well that we can talk about here in a second, but let's listen to the governor as he told us about this earlier.
Would be additional payments to support, and listen very carefully because I particularly think this is important as well as all the rest of them. Additional payments to support nurses. This will be an additional $1,000 a month, $250 a week for non-physician direct care workers, primarily nurses, and $2,000 a month for non-physician direct care workers who are in a facility treating COVID-19 patients. We're going to need these healthcare workers, and they're at risk. We want to make sure that they are incentivized to be there in addition to their public-mindedness. And so this will be a direct support for the nurses and will help in the recruitment of those nurses to these at-risk facilities.
Aggressive steps being taken by the Arkansas governor to hopefully keep our healthcare providers well taken care of during this difficult time, but a lot more stuff still happening. Now, no shelter-in-place order issued. I just want to repeat that. No shelter-in-place order has been issued as of today. We will see if that changes going forward in the future, right? We don't necessarily know. But what we can tell you at this exact moment is that there is a directive banning social gatherings larger than 10 in Arkansas. That was issued on Wednesday. For those asking that, or did ask in chat, they thought that something like this already existed. Well, it was a guidance previously, a guidance from the president, a guidance from the governor, but now it's an order from the governor. The police could fine you, or I don't know how else, but they could definitely enforce this with the law if those people that might be in a gathering larger than 10, a social gathering, refuse to disperse. But it's all about public safety. The governor even saying, of course, he wanted to be able to give some teeth, basically, to the enforcement of this attempt to quarantine this virus away. Now in Randolph County, where one confirmed case is, of course, being confirmed by the Arkansas Department of Health. 5 negative tests total, meaning 6 tests overall have been made in the county. That's it, 6 tests. And that's a number that we're kind of highlighting today a little bit more because it's the numbers that have stayed the same in Northeast Arkansas are in counties where very few tests have been processed. We'll tell you what we're talking about in a minute, because as of right now, the numbers are still 4 cases in Craighead County confirmed of COVID-19, 1 in Lawrence, 1 in Greene County, 3 in Poinsett, 3 in Independence, and the 1 in Randolph we just told you about. 1 in Cross County, 7 in Crittenden County, which is next door to Shelby County, Tennessee, where they have over 200 cases. They're having a hard time over there. And 1 case in White County, too. But here's the thing we were talking about earlier. The completed tests that include the positive results, by the way, total, have only been 9 in Craighead County, 6 in Randolph County, less than 10 in Greene County, probably a lot less. It's tough to say. We only go based on the range that they give us. But look at that. 9 tests in Randolph County, 4 of them positive. So whenever we see the numbers not adjusting, there's a reason for that. It's because not enough tests are being processed, and we don't have an accurate representation right now of how many people have this thing. Not in Northeast Arkansas. We do more in other states and in other cities, like in New York, where over 20,000 are now confirmed to have COVID-19. The numbers nationally have gone up exponentially over the past several days. Right now, we're at 75,000 plus. This was actually probably about 30 minutes ago when I pulled these numbers, so whenever you go to the website now, they've already increased, and they're going to by the time you look at them as well. Over 1,000 fellow Americans have died from this, and that's very early on. And I say that because we're looking at only right now about 600 people that have recovered from this totally, out of over 75,000. So that means over 75,000 still have it, basically. Globally, 510,000 plus infected, with almost 23,000 dead, according to Johns Hopkins University. And 120,000 or 121 or so of those infected recovered, meaning that about 390,000 still have it and are still battling the symptoms. Here's where we were on Tuesday when we did this broadcast live last. On Tuesday, we were at 81,005 in China, 69,000 cases in Italy, and 51,000 in the United States. Today, 2 days later, here's what they've done. Here's what the cases have done in all 3 of those countries. They're still the first, second, and third, but that's not going to last very long, because right now, we're looking at 81,000 still in China, about 11,000 more in Italy, and the United States, about 25,000 more, and growing. It's gone up since we've been talking here, since I've made these full screens. The cases in the United States continue to go up at an exponential rate that will put the United States as the most infected country with confirmed cases of COVID-19 in the world, at least based on the numbers. Of course, we've talked about before, China is saying that they have this thing contained. And maybe, and hopefully they do, but the Chinese government has not been the most forthcoming government about this stuff. That's not to say ours is exactly being honest whenever they're giving federal press conferences suggesting this thing is a hoax or it's under control, when neither of those things are true. But we need to point out that China really did cover this thing up for the longest time and still kicks out journalists from their countries. Italy, where the death toll is over 8,100, has a 10% mortality rate, largely because they exceeded the capacity for their hospitals. Once that happened, the mortality rate dramatically increased. Went from about 2% to 10% plus, which is where it's at now. And in the United States, if you're looking at that number that says 1,000 dead, and you're trying to draw some level of reassurance that it's lower death rates here, well, remember, only 619 have recovered so far. That means well over 75,000 Americans, because of the math that's been added since then, not compared to what the number is up there now, well over, are still infected with the coronavirus and still must try to recover from this. New York particularly has been hit the hardest, but as we see the numbers continue to grow, and more concerningly, we see the number of tests barely creeping up, it's a concern for all of us. Joining us on the phone right now is Dr. Shan Speights, the Dean of the New York Institute of Technology College of Osteopathic Medicine at Arkansas State University, and a friend of mine, somebody that I've known for quite a while. Not afraid to disagree with me if he disagrees. This is somebody, though, that's been busier than ever these days, and we really appreciate him for taking a few minutes to talk to everybody. Thanks for being on with me.
Well, thank you, Stan. Always appreciate the opportunity to speak to you and speak to your listeners.
Yes, sir. We appreciate you. And we want to get right into it. Lots of information and misinformation out there, too. People comparing this to saying it's nothing different than the flu and other things. Tell me, why is the coronavirus, COVID-19 specifically, different from other viruses and things we've seen?
It's a great question to start off with, Stan, and I get this question actually quite a bit as well. People make the confusion that why isn't this any different than what we see seasonally with influenza? So here's the big take-home point that I want everybody to understand. This is not a virus that humans have ever seen before. So, and people may not recognize this, there are actually viruses that are passed back and forth between animals and between different species that humans never contract. So what happened was, this is actually a virus, and this is what happened over in China. It actually was a virus that occurred in bats. And so it made a jump. The virus basically changed its genetic code a little bit and made a jump from bats to humans, which has never been done before in terms of this kind of virus. So then it started to spread rapidly amongst humans. That's the big deal here. We see influenza every year. We see different types of influenza. You may even remember back at the H1N1. That was an influenza. Again, a little different type, but we were concerned about that one. This virus here today, this COVID-19 coronavirus that we're seeing, is new to the human species. That means that we don't have an immune system already set up to fight it off like we do the common cold or even influenza. So this is a brand new virus to humans. We don't have a vaccine for it. We don't have medication treatment for it, which means the only way that you're going to defend yourself is through your own body's immune system.
What happens if we exceed hospital capacity?
You know, I'll say this, and all across the country, these conversations are happening. And Northeast Arkansas is no different. I feel, and I've been involved with these conversations, I feel very good about the conversations that are going on with our hospital leaders all across Northeast Arkansas, certainly starting with our two major hospitals, NEA Baptist and St. Bernard's, but all across the region with even our smaller hospitals in Northeast Arkansas. We want to make sure that everybody's involved and everybody's got a plan together. And so just so that the listeners can understand, those conversations are going on now so that there are plans in place. Now, back to your original question, what happens if you exceed hospital capacity around the region? Well, then there's a plan B and a plan C on what are the alternative locations that we can be looking at to basically create an overflow. Where we don't ever want to get, and where I don't think we will get, is to a point where a critically cared patient that's on a ventilator is being cared for somewhere outside of an acute care facility. I believe that we have enough capacity within Northeast Arkansas so that the patients in this area will get the quality care that they deserve and that they need at that time. So I feel comfortable with the plans that are being discussed right now.
So I'm looking at the numbers on Johns Hopkins University right now, and the United States is up to 76,000 as of the latest numbers, 76,514. And I'm seeing that as a comparison to Italy is at 80. China's at 81.7. What does this mean when we see this number go up like this?
So this is what everyone is watching from an epidemiological standpoint and from a research standpoint. So we're watching these numbers. We're watching the rate of increase. You may have heard this flattening the curve, and that's what we've been trying to do for the past several weeks. And that's why we've been encouraging individuals and people to stay inside, to social distance, don't gather in large groups, because the virus jumps so quickly from person to person, and an individual can be infected for several days and not even know it, which means they can have the virus, not have symptoms, but yet spread it to somebody else. That makes the virus very deadly, very transmissible, and that's the biggest concern. In terms of the current numbers, remember, the United States is a larger geographic mass than Italy. Now, Italy is more dense in terms of population. We do have concerns based on what we're seeing in Italy, Spain, and even Germany in terms of their rate of increase and how that affects us. when we think about what does it look like here for the United States, or even, more importantly, what does it look like here for Northeast Arkansas, for Arkansas, we start looking toward the East Coast. So we look to New York, we see their rate of increase, we see what they're grappling with, and then we start trying to decide how is that going to affect us. There are several models out there. University of Pennsylvania, Harvard University are putting out different models. The CDC has also put some information out. All of those are just guesstimates right now, for lack of a better term, to try to figure out what could we see here. The other piece that's kind of a wild card is we've implemented things a little quicker than some other places. So in terms of what you've heard from the governor, what you've even heard from our mayor and our county judge, in terms of the social distancing, in terms of the school closures, in terms of even individuals working from home and doing telecommuting, those are things that all will limit and slow the spread of the virus. So we've got to kind of wait and see how beneficial will that be for us when we really start seeing an uptick in the numbers in our region.
So I have two questions left, and one of them I had already planned to ask, and you know it. The other one I wanted to ask kind of off of that. Do you think we need a shelter-in-place order in this state right now?
I think that goes both ways, and I don't know that right now that's a direction we have to go in. I want to say that I have been, and I am complimentary of the governor and how he's handled this. I happen to know Dr. Smith personally. I think very highly of him. He's our Secretary of Health over the Arkansas Health Department. I think he does a phenomenal job. I think he's done a great job. I think under his leadership, the state, for the most part, has done well. Remembering, this is hard to plan for anybody. Even the best laid plans, when something like this comes up, you're kind of just making decisions on the fly based on how the virus changes and based on how the disease spreads and how many cases you start seeing. So I do feel comfortable with where we are now. I don't know that at this point we have to get to that, because we do have a balance. At the end of the day, we still need police officers and firefighters, and we need the trash picked up. I need the water to come on my house when I turn the faucet on. There's a lot of things that go on there, not to mention just the economic drivers that occur from the things that occur to keep our cities and counties moving. I don't know that there would be a huge benefit right now as long as individuals are doing a good job social distancing. In most places that are more densely populated, the shelter in place has come about, to be honest with you, because the population just kind of ignored or really didn't listen to what was going on per government recommendations. I'm not convinced right now that that's something we have to do. However, it wouldn't surprise me if it did come.
Best advice to stay healthy right now, what would you tell people?
Everybody, I know that they roll their eyes when they hear me say this: washing your hands, and yes, don't forget to wash your hands. If you haven't had a flu shot, there is still influenza circulating around, and you should get that to protect yourself. Again, I'm going to go back to what I said at the very beginning of our interview, Stan. This is a brand new virus, and we don't have any natural immunity to it. So what's going to happen is when you become in contact with it, you're going to have to depend upon your body's own immune system to fight this off. So you want your body in the best shape possible. Walking around your neighborhood. I don't expect somebody to go out and run a 5K that's been sitting on the couch for the last 15 years, but walk around your neighborhood, increase your heart rate, increase your blood flow to your body, maybe increase your respiration some. People don't recognize this, but just sitting still, like you and I are right now, I'm sitting in a chair, and I'm sure you are too. We're not using our full lung capacity just sitting here talking and just normal respiratory breathing. We only use about 40 to 50%. We need to recruit more of our lungs to be able to build our body's immune system up. And that's why things like just simple walking around the neighborhood and physical activity help. Those boost your immune system. So start right now in doing that, because I promise you, you will fare better against this virus and other diseases because of that.
Dr. Shan Speights on NEA Report. Thanks for being on with us, sir.
Thank you, Stan. I always appreciate talking to you.
Everyone's question today is, how will you get paid if you get this money from the government? Well, we did a little bit of research, and although the stuff still has to go through the House of Representatives and be signed by the president, basically what we are looking at is that, according to MSNBC, you'll get paid the same way that you got paid with your taxes. If there's a direct deposit option that you did while filing your taxes, you're going to get it a lot sooner, probably in about 3 weeks, they said. Checks by mail may take longer. Of course, we've still got to get this through the House and then to the president's desk, but that's expected to happen. House Speaker Nancy Pelosi even saying it will be passed, but she also said there will be some debate about it. Well, an advisory was issued by the Arkansas Department of Health today. We want to tell you about that because it was for several different people, for people that traveled from New York State or to any international location at all. The Arkansas Department of Health recommending self-home quarantine for 14 days for all travelers from New York State and any international location. If you haven't looked at the numbers, New York is being hit terribly hard by COVID-19, and the growing number of international locations is going up too. So in the interest of public health, the Department of Health has announced that all travelers coming from one of those locations are advised to quarantine at home for 14 days, starting from the date that they left the location that they were at. Really important now, if you develop a fever, a cough, or other symptoms of COVID-19, contact your doctor for advice on where to be evaluated. When they say contact, they mean telemedicine or phone. They don't mean going to the lobby and stand around potentially contaminating 25 people. If you don't know, I'll run through the brief steps of home quarantine. Remain at home, avoid public activities, don't have visitors. Stay in a separate room from other people if you live at home with others. If not possible, wear a face mask when you're in the same room as others and stay 6 feet away at least. Wash your hands and use alcohol-based hand sanitizer often. Don't share personal items like dishes, cups, forks, spoons, towels, etc. In fact, this is good advice for anybody, really. Do not leave your home except for medical care. If you get to see a doctor for reasons other than a medical emergency, if you need to, rather, call that medical provider, as I said, first. Don't go there. In the event of a medical emergency, call 911 and then tell them you're in a self-home quarantine for novel coronavirus exposure. Keep the face mask on until the health provider asks you to remove it. And don't use public transportation. Finally, check your fever twice a day. Those steps, very important, but that's for people in a home quarantine situation. So we wanted to let you know that. Also something to let you know, a very positive bit of news in a really dreary world right now, it seems. NicePack has announced that they're going to hire over 100 in Jonesboro thanks to the increased demand. In fact, they sent me this press release over directly this afternoon, and I was so happy to see it because we needed some good news to tell you about. Believe me, we want to tell you good things. I just noticed, and I know this is really random, it looks like there's hair growing out of the world that's spinning on my Super, if you look at that, because of the virus in the background. Anyway, sorry. Okay, so let's tell you about NicePack. Planning to hire more than 100 employees at the Jonesboro production facility. Because, if you didn't know, NicePack makes sanitary wipes, right? The press release says that they're going to hire more than 100 in both temporary and full-time capacity combined, so it's going to be a mix there. If you want, you can contact them. I've got the email address on the screen, jonesboroarjobs@nicepack.com. It's because of the COVID-19 pandemic, and they said because the demand for their products has just increased. They're going to be hiring people like machine operators, forklift drivers, maintenance, clerical workers, serving across all shifts. The company will offer training for all skill levels, too. NicePack's a premier employer in the area. They were championed. In fact, when I was back at KISS FM, I remember them coming into town. It's a pretty neat operation. They have the nice and clean premium wipes, antibacterial hand wipes, baby wipes, moist towelettes, and other things. So, some positive news there in the community, especially with a lot of people looking at job losses. Maybe an option for you right there. So there's been a lot of negative news, as we mentioned, and unfortunately I do want to mention these numbers because they're the latest numbers, 79,785 in the U.S. as of right now. We are less than 1,000 cases away from Italy. Without a doubt, within the next 24 hours, we will cross that. Just looking at the rate of increase that has happened thus far, I thought there was a chance we might cross it during the broadcast here. And I'm doing a refresh right now. Oh, wow. Okay, so we are now over 80,000 cases, 80,021. I don't even have the right numbers up on the screen. Those are going to change all throughout the day and all throughout the night, too, as other countries update theirs, and then into tomorrow. Just got to tell you, got to keep a watch on those. So let's also make sure the stuff we share has sources to it as well. You see on all of our screens, all of our full screens, all of our reports, we always make sure everything we say is sourced somewhere. Because unless we are the ones that came up with it, we should have a source. Thanks, everybody, for watching. If you think our broadcast was somewhat helpful, maybe kind of helpful, or just kind of enjoyable at some points, we would appreciate a like, a share, or a subscribe if you're on our YouTube channel. A lot of you are. Support local news and become a supporter for just 99 cents a month if you'd like. And we have extra broadcasts for our supporters every week, along with extra content too. It's always good to have you in with us today. Always appreciate everybody for following the page, and those that do, I know you want to stay informed. And so that's the goal, is to try to keep you informed about what's up and what's happening around here. With the simplest terms, no waffling around, no spin. And we hope that we provide the best information we can. A lot of folks say, hey, I've seen some of the comments. Some people think that that what we're doing isn't helping. But I got to tell you, what we're doing is telling you what the experts are saying. So all we're doing is giving you information. And information helps people, especially intelligent ones, make good choices. And so we hope you do that. Stan Morris reporting in Jonesboro for NEA Report. Hope you have a great and safe evening. We'll continue updating the site throughout tonight. So go there, neareport.com, if you want more news from Northeast Arkansas.